my name's Krishna. I'm a student paramedic. Would it be okay if I check some vital signs today?
Sure.
Thank you. Can I start by checking your pulse?
Okay.
Thank you. So I've located your radial pulse, which is usually proximal to your thumb, and I'm just going to start counting your heart rate. Okay, so your pulse is nice and strong. It's about 60 beats per minute, which is absolutely normal. Now, would it be okay if I check your blood pressure?
Yeah, sure.
Thank you. This is our blood pressure cuff. I'll just get you to stretch your arm out for me. If you have a look, there's a little arrow here which generally indicates where your brachial pulse is. I'm going to attach this over here. Now I'm going to pump up the cuff. It'll get a little bit tight, so let me know if it's too sore. Just relax. Great. So your blood pressure is 115/70, which is absolutely normal. I did this by listening to some sounds. The first sound that I heard after releasing the cuff was the top number, which is considered the systolic blood pressure, and the last sound that I heard as I deflated the cuff was the diastolic. Now, can I please check your temperature?
Sure.
Thank you. So this is my thermometer. I'm just going to put one of these protective covers on and then put this into your ear. Is that still okay?
Yeah, that's fine.
Just relax. I'm just going to pull your ear gently. Thank you. So your temperature is 36.3, which is absolutely fine. Cool. Thanks for that, Luan. Now, would it be okay if I have a listen to your chest?
Yep.
Thank you. So I'm just going to stand up, and if I just get you to sit straight, I'm going to have a listen to the front side of your chest, okay, and then the back side of your chest. All right? While I do this, I'm going to be listening to the depth and clarity of your lung sounds, okay? So just relax. Breathe normally. Okay. Now can I put this just inside your collar?
Yeah.
Cool. And this side. Alright. Now I'm just going to listen to the back here. Just relax. Cool. Nice deep breath in and out. One more in. Thanks for that. Now, while I was listening to your chest, I couldn't hear any unusual sounds. Your breathing sounds were nice and loud, nice and clear, and your respiration rate was approximately 16 respirations per minute. Now, this is an oxygen cylinder. Although it says compressed air, we're going to pretend that it is an oxygen cylinder. Now, to check and maintain one of these, it's very easy. The first thing you should do is check to see how much oxygen is inside. And the easiest way to do this is turn the valve up the top here, see the needle move, and it should be optimally in the green region. Now, to check the flow rate, close the top valve, open this valve here on this side, and make sure there's no blockages. Once it's completely empty, close the valve over here, and you're done. The regulator here can sometimes have some issues with the Botox seal, which is inside. Now, to check the Botox seal, simply twist the pin on the end here, remove the regulator, and look inside. If you hear any leaks or any gas escaping, it could suggest that the Botox seal needs to be readjusted or replaced. Now the Botox seal is inside, and it has usually a little ring like this. Once it's been replaced, you pop it back on and align the 3 pins and spin the pin on the outside. Only perform a gentle 3/4 turn to lock it in place. So for this part of the video, I'm going to be demonstrating how to use an acute mask with an oxygen tube, an oxygen cylinder, and how to administer oxygen to a patient. First, we obtain consent from our patient, asking if we can administer oxygen. Then, once we have gained consent, we attach our oxygen tube to the acute masks over here, and then we connect it to our oxygen cylinder. Once it's connected and in place, apply the mask to the patient, tighten the ropes to ensure a snug fit. The acute mask can deliver up to 60% of oxygen at 6 to 8 liters. The indications of oxygen include traumatic brain injury, reduced GCS, a low oxygen saturation of less than 94, shock, or someone who is in respiratory distress. Something to be cautious of is if somebody has a history of COPD, be mindful of how much oxygen you administer. In this video, we'll be demonstrating how to use a bag valve mask with a reservoir. Make sure there is no breaks or cracks in the reservoir to ensure full inflation. Check by inflating the reservoir fully and make note if there's any tears or any leaks. Once you have checked that the reservoir is intact, apply it to this end here and connect the mask. After you've connected the mask, you can attach the oxygen tube to the end over here and connect the other end to our oxygen cylinder. If your patient is unconscious, they may require an OPA or an NPA to keep the airway open. You must assess their GCS before proceeding. Apply a bit of lube onto your OPA and insert it into the patient's mouth while turning 180 degrees. Once it is in place, you may now attach the bag valve mask to the patient using a C grip and putting slight pressure on the jaw. Once it is in place, turn your oxygen on to about 10 liters to begin with and perform ventilations. Ventilations should be done between 5 to 8 seconds. Keeping in mind, when you are doing ventilations, make sure you look for a chest rise and a chest fall. If you see a bit of gastric inflation, you can apply a bit of pressure on the cricoid area here to push the trachea posteriorly. First thing you need is PPE, and you should always assess your wound by exposing it to have a look at how much care you will need to provide. First thing you do is you get some saline and some gauze. After obtaining consent, ask if you can clean the wound. Can I please clean your wound? Yeah. Thank you. And when cleaning the wound, it's important to remember, always go out away from the wound, collecting any debris or any excess blood. Once that is all clear, apply a bit of dry gauze. While bandaging and traveling over the wound, you can also perform a small twist and continue wrapping your wound. This way it'll apply a bit of pressure to help prevent any excess bleeding. In this situation, I have identified a catastrophic bleed. My first priority is to control the bleed by applying a tourniquet. Find the best suitable position, approximately 10 centimeters away from the bleed. Then once you've located 10 centimeters away, apply the tourniquet nice and tight and turn the windlass until you cannot feel the radial pulse and the bleeding has stopped. After we have applied the tourniquet, make sure that you write the time, reassess if needed, and apply second tourniquet if the bleeding continues. In this video, we're going to be demonstrating how to splint a lower limb. Now, John, can I roll up your lower pant sleeve to have a look at your leg?
Sure.
While we're rolling up our patient's sleeve, we need to check if there's any gross deformity or any major swelling. Now, to further assess your injury, you can use the plus discs acronym. And we can also make sure that there is no neurological deficit or problems with circulation. It's important to remember that you note any shortening or lengthening of any legs. In this situation, I'm going to feel the pedal pulse to check circulation. John, can I feel your pedal pulse?
It's fine.
Just going to assess. Yep, so we have a pedal pulse which is present. John, can you wiggle your toes for me?
Yeah.
Quite sore?
A little bit.
On a scale of 1 to 10, how bad is your pain, John?
When I move my toes, probably around 6.
About 6, okay. How about if you try and move your foot?
Yeah, it's still about the same thing.
Still about 6. Now, before we do anything, we must intervene and give some pain relief. One of the choices you can give for interventional pain relief is methoxyflurane. Which is fast acting and it is self-administered. Before we give methoxyflurane, we must ask if there's any allergies. John, do you have any allergies?
No, I do not.
Any family history of renal impairment or renal impairment for yourself?
No.
No. Any history of malignant hypothermia?
No.
And have you had this in the last 7 days?
No, I have not. No.
Okay. Once we have ascertained that information, we can go ahead and give our methoxyflurane. In this case, this methoxyflurane has already been used, but before we do it, we need to make sure that the carbon is activated by inserting it up into the top here, pouring our methoxy into the bottom of the tube. It's very important that our patient is awake and able to obey commands, otherwise it is heavily contraindicated. So John, I'll just get you to hold this.
Sure.
And we'll just pop this over your wrist. Okay, now your first few breaths should be nice and slow, and then just inhale and exhale as you feel comfortable. We can get our cardboard splint ready and slide it through. John, I'm just going to lift your leg and slide this under your foot, okay?
Yeah.
Alright? You're welcome to use the methoxyflurane if you need to.
I'll be fine.
Okay, alright. Now, we're just going to tape the ends and bandage it using some triangular bandages. You doing okay with your pain?
I'm doing good, much better.
John, I'm just going to lift your leg.
Yeah.
And while you're bandaging, it's important to remember that you don't tighten too much, because we need to reassess the limb to check for any deficits in sensation, any increases in pain, or any numbness. In this video, we're going to be demonstrating how to use a stiff neck collar. Indications for a stiff neck collar include suspected spinal injury, serious falls, or motor vehicle accidents which occur at speeds greater than 30 km/h. The NEXUS guidelines state that if a patient has central C-spine tenderness or pain, even numbness, and altered sensation, we can use a C-spine collar to immobilize the neck. Now, before we continue, we can use a towel and place it under our patient's neck to make sure there is neutral alignment. Now, Tyler, I'm just going to put a towel underneath your neck. Is that okay? Yeah. Thank you. Liam, can you please lift up Tyler's head so we can put this towel under his neck? Alright. Fantastic. The next step is to now measure our patient's neck for our stiff neck collar. Now, Tyler, I'm just going to put my hand on your shoulder here and ask Liam to gently lift your head so we can measure your neck. Is that okay?
Yeah.
Alright, so Liam, if you just lift his head, I'm just going to put my hand over here. So now that we've obtained the correct size, we can now go ahead and adjust our stiff neck collar. Make sure the pins are not pushed in, adjust the size accordingly, and put the pins back into place. Once we've got the right size, we can now go ahead and put our stiff neck collar on. Now, Tyler, we're just going to lift your head so we can put this collar on. Is that okay?
Yeah.
Alright, Liam, you ready? Just lift his head up a little bit. We'll slide it through. Let me know if there's any pain. And it's important to remember that you must bend the stiff neck collar before applying it so it's easier to put on your patient. Make sure it's nice and secure and gently put his head back down. In all ambulance trucks, there is a suction unit which is available if we need to perform suctioning. Now, it's important to check that your suction is fully functioning and working. To do this, flick the suction onto full, occlude the tube, and hold the test button. While it is testing, make sure that the suction is increasing in pressure to ensure that it is at full capacity. Okay, so it has passed the suction test, and the indication to suction is if you have a patient who is unconscious or has just been vomiting. Ideally, what you must do is turn the patient's head laterally and turn the suction onto full, occlude the tube, make sure you've got some suction going on, and only suction as far as the eye can see. While you're suctioning, make sure that you suction in circular motions on the way out for no more than 10 seconds. You should not use a hard catheter to suction in a moving vehicle. This video will simulate a resus. Before we go to the scene, we must assess and make sure there's no dangers, any hazards, or any people that could harm us. We're approaching the scene, checking for dangers, we're clear, checking for response. Sir, are you okay? This is the ambulance. Can you hear me? No response, checking airway, listening for any breathing, feeling for any breathing. It's not breathing. John, we need to start CPR. Attaching AED. Turning it on. This is AT1
Analyzing heart rhythm.
Attending R49, requesting R50.
Shock advised. Charging. Stay clear of patient.
Staying clear. Attaching
Deliver
oxygen.
shock now. Press the orange button now. Shock delivered. Pause.
Measuring
Start
OPA.
CPR.
Inserting OPA. Oxygen at 15 liters.
36, 37, 38, 39, 40.
Tilting chin. Chest rise. Chest rise. Chest rise. Chest rise. Chest rise. Chest rise. chest rise, chest rise. Chest rise, chest rise. Chest rise, chest rise.
Stop CPR. Analyzing heart rhythm.
Swapping.
Stay clear of patient.
Staying clear.
Stay clear.
Analyzing heart rhythm. No shock advised. Pause.
Continuing CPR.
If needed, start CPR.
'28, '29, '30. In this video, we'll be demonstrating how to use a MRX Philips LifePak machine. Now, first thing we'll do is we'll do a battery check. To remove the battery, we squeeze the sides, pull it out, and push the button. This tells us how much charge we have, and if we need to replace it, we can replace it. Before we operate, we must check if we have any paper. To check the paper, we look into this compartment here, checking it out, and seeing that we have enough roll. If there is little paper, we must replace it. In this part of the video, we're going to see what's on either side of the MRX machine in both pockets. Now, on this side here, we will have a test load, which is usually located at the back. We'll have a CPR puck, which is inside the machine. We'll have our 12-lead ECG. And on this side, we'll have our SpO2 monitor, a CO2 monitor, and a non-invasive BP cuff, along with your 3-lead ECG. Now, once we're happy that we have enough paper and both batteries are charged, we can go ahead and do an operational check. Turn the machine on, let it boot up, and check both batteries A and B have sufficient charge. Now that the machine is on, we can perform a self-diagnostic test. So we push menu, scroll down to other, click on operational check, and run an op check. Before we run an op check, we'll attach a test load so it also checks the defib. We've got the test load attached, and now we'll run the op check. We acknowledge because we're doing a check and let it go through its check. We're turning the knob to 150. We've made sure that the test knob is attached. We're going to click charge. And we're going to push the shock button.
Shock delivered.
We're going to acknowledge that we heard shock was delivered. Click yes. Now, once the check has passed, it'll print out a report and we can make the changes that need to be made. And once we're done, we can exit the op check. Now we will perform an AED check and run a test load. To do a test load, we attach the test load to our AED pad connector and turn it to AED.
Analyzing heart rhythm. Do not touch the patient. No shock advised.
We're going to put it up to 50
if needed,
and we'll charge. Once we're ready, we can shock. And the shock has been delivered. To disarm the charge, we can push the disarm button here and disarm the charge. Now in this part of the video, I'm going to show you how to adjust the size of waves and change leads. Now, ignore the waveform on the monitor because it's connected to myself and I'm moving, there will be a lot of disturbances. To change the lead, push the lead button here, selecting the leads, and if a lead is disconnected, there will be a message which says the lead is off. Now, I'm going to move back to my connected leads and I'm going to show you how to adjust the size of the wave. To adjust the size of the wave, we push the menu button, click on Displayed Waves, choose Wave 1, V1, and then push ×4. As you can see, the waves are a lot larger, and there has been a change on the monitor.